All right. Well, thanks everyone for coming today. As a coordinator of the Visual Art and Design Forum or VADF speaker series, I'm really pleased today to welcome you to a webinar called Co-Design Beyond Pandemics, Creativity and Making. The presentations that you'll hear today are featured in an international research project called Recovery and Renewal of Participation in Healthcare Change. This project, actually going over the last couple of years, aims to build capacity and resilience in co-design and health. The project team has been exploring how co-design practices evolved to engage or disengage the most impacted communities in health service design, delivery, and improvement during and beyond a pandemic. The projects you'll hear today specifically are related to creativity and making in the co-design process. So this is also a VADF talk. So this is the second talk in the Visual Art and Design Forum Fall 2023 speaker series. And it's the second webinar in the Co-Design Pandemics webinar series. So if you'd like to join the Co-Design Beyond Pandemics webinar series, at the end of the slides, we have a way to join the community of practice so that you can catch the next one, which is also being hosted by the VADF in 2 weeks on October 12th. Okay, so next slide. So at this time, I'd like to acknowledge the Indigenous peoples of all of the lands that we're on today. I am situated at the University of Alberta, where its buildings, labs, and research stations are located on the traditional territory of Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, and Anishinaabe nations. While we meet today, though, in a virtual platform, we can all take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous people and their cultures. So, schedule for today, we have 3 speakers, which I'm really excited to present. Dr. Kate Sellen is an associate professor in the Faculty of Design at Ontario College of Art and Design and a Tier 2 Canada Research Chair in Health Design. She is the director of the Health Design Studio at OCAD-U. Much of her work focuses on design for patient safety in safety critical or highly sensitive topics, including the dosing, ordering, tapering, and management of opiates, as well as communication at the end of life and the issue and delivery of blood units for surgery. Our second speaker, Michelle Chan, recently graduated from Emily Carr University of Art and Design with a bachelor's degree in design. Before joining the Exchange Lab, Michelle was a service designer with the Ministry of Citizen Services, where she worked on COVID-related initiatives. In August of 2022, she started the research team on the multi-language project. She's currently a senior UX designer and service designer with Exchange Lab, working on an internal resource site, digital.gov. And our third speaker is Christine Wattridge. Christine Wattridge is a program coordinator and studio manager at the Health Communication Design Studio at Washington University in St. Louis. 2022 grad of the Sam Fox School of Visual Art and Design. Her work merges co-creation practices, health communication methods, and public health research and evaluation principles. She collaborates with project partners to work with and for St. Louisans, designing a solution for local health equity issues. She's currently managing social media for a health information monitoring and response system, redesigning an action plan for asthma, and creating print materials dedicated to sharing information about long COVID. So those are our 3 speakers. What we're hoping to do is finish by about noon with about 15 to 20 minutes per speaker. There'll be a time for discussion about creativity and making in the design process. Thanks, April. I see that you switched to the next slide. This project is a collaboration between the Health Design Studio at OCAD, Design Health Research Innovation Lab at the U of A, the Health Design Lab at Emily Carr, SC Research Center at St. Elizabeth Health, the Lab for Living in the UK, and the CoLab for Community and Behavioral Health Policy at the University of Washington. So now that the introductions are done, I'll hand it over to Kate, who is our first speaker.
Thanks, Gillian. So the project that I'm going to share today briefly is one that arose out of the situation of COVID, and it is a project we call COVID Printables. We were running it for about 2.5 years. We're extending it a little bit now, and it was unanticipated, and it's really about providing guidance to community members. It ended up being a tool for refugee and community health groups, mostly for sharing with people who were most at risk for COVID. And by the end of the project, we had a lot of use of the actual tool itself in practice, and the tools had spread rapidly through very informal means on networks and sites, and through general sharing. And we won an award for the work from the International Institute for Information Design in 2020, actually 2 awards. So I'm just going to give you kind of an overview of how we came to this project, and relate it to the sort of creativity and making question that we're discussing today. So next slide. Thank you. So we were actually, at the time COVID hit, we were working with a local emergency department on a project to support patient communication at discharge. And it was intended to be very supportive, easy to understand information that was geared towards people who have low literacy or English as a second language. And it broke down to 3 very simple ideas: what happened, what to do, and how to follow up. We used an inclusive design approach, and the idea that we would do this in a very engaged co-design process with many different stakeholders. So when we were initially working on this project, we were in the emergency department. We just got ready to do our first multi-stakeholder workshop. I think we had maybe 40 people ready to go in a big in-person event with materials and stickies and lots of the usual co-design stuff that we found sort of pre-pandemic. And then the pandemic happened, and being an emergency department, it was one of the first sort of areas that was really taken up with the response. Next slide, please. So we had done, our discover phase and defining the issue. We were at the ideation point when we had to pivot. So one of the things I think is critical to the success of the Printables project, which is what happened next, is in fact the relationships that we had already built up with the staff in the emergency department. And that includes physicians as well as nursing staff and epidemiology and other groups. We had a number of students who were working with us from the medical school and U of T already in the project. And then that actually proved to be really pivotal to the next phase, which was all orientated towards COVID response. Next slide, please. So the pivot was really about meeting stakeholders' needs. And so if we look at the principles behind co-design, part of that is responsiveness and taking account of sort of deep listening in terms of what stakeholders need, what community needs. And at this point in time, what the emergency department needed was a piece of communication to give to people who weren't sick enough to be in the hospital, but needed to know how to look after themselves or a loved one in a way that was effective, given what we knew at the time, which was very little. So in a safe way that was also not going to result in other members of their family or a community becoming sick. We had to pivot very rapidly, and that involved opening up our prototyping techniques to a much broader audience, and so involving multiple stakeholders in the prototyping process in an open and very continuous way. So previous, I think, to the pandemic, we would have been running our stakeholder workshops, gathering evidence, gathering community needs, requirements, ideas, doing perhaps some, because this is a communication design project, perhaps some sort of on paper prototyping together, actually in person. But then bringing that back into the studio and working as a design team on a refining an output to then bring back to the stakeholder group. That process is sort of moving in and out of collaboration. That broke down completely. We had a very, very tight working relationship where pretty much all of our making, even some of the graphics, we were actually making on the fly with stakeholders in a collaborative digital space. And what that enabled us to do was to integrate the evidence perspective, the on-the-ground context perspective, so the needs of the communication interaction that was happening between physicians and people coming into the emergency department. So we had a really close tie between the design choices we were making and the actual people who were using the tools. And I think the other things that changed for us in terms of our process were we did sort of, in contrast to what I've just said, we ended up reverting to a more traditional testing type of mode, which was actually quite uncomfortable at the time. So previous to the pandemic, we would have done through that workshop process small types of testing with community members as we moved through the process. What we ended up doing was, in fact, having more formalized testing of the sheets. So these are just a reminder, one-page sheets with COVID guidance. And we made that change because we wanted to reach a much wider group of people. And we had started to collaborate with a number of different organizations working in the refugee and community health space. That was also a big shift. So we went from doing work for an emergency department to our tools being taken up unexpectedly in the refugee community health sector. And because of that, we needed to reach a much wider group of people who were representative of different community groups. So that was an uncomfortable shift for us, but it was a necessary shift to get the tools to a point where they could actually be spread and used. We also, which something quite not so dissimilar to the work that we've done on overdose, but in a little bit of a different way, we took direction from activist voices on social media as input to the design process. That was critical from the point of view of meeting the needs of marginalized groups who were not represented by existing public health guidance. A good example of that is how to social distance and keep safe within an apartment building setting. Pretty much there were no examples of public health organizations who were addressing that specific issue or using public transit. So these kinds of issues that were just not being covered specifically, we picked up on through watching activist voices on social media. We were also receiving requests now through our web presence. And so that idea of responsiveness and feedback and community-based knowledge was very tightly coupled in the project through these digital mechanisms that we probably would have made efforts to manage in a less inclusive way. I think previous to the pandemic, we would have focused on our core group of community members as opposed to bringing in multiple voices in this very emergent kind of way. Next slide, please. This is how we used to work. And next slide, please. This is how we were working. So you can see multiple people are on the screen at the same time. We're editing, we're swapping images in and out. We're sort of prototyping on the fly, bringing in as many voices as we could with particular principles to arrive at something that was actually going to be useful. And next slide, please. So the key outcomes were really a regular commitment of time. When I say key outcomes, I mean things to note about the process. So regular commitment of time from a ever expanding group of people who were sharing their insights. Real-time digital prototyping. We needed those skills. So digital prototyping skills that we had sort of pre-pandemic that we would have had within the team as opposed to sort of opened up to everybody in the process. We're now really happening in front of everybody in the process. Multiple voices were involved, as I've mentioned before. We had directly engaged organizations and providers on a much bigger scale. We had testing on a much bigger scale. We needed to rely on translation services to make this effective. And we also had a digital implementation strategy that we probably would not have necessarily considered previously. Most of the work that we've done previously has been quite localized. We engage in co-design with community groups in a local context. Yes, we think about adoption and spread beyond the end of the project, but it wasn't actually built into the entire process of the work. Whereas this new context, the pandemic context, and the type of work we were doing really lended itself to an open innovation approach, which is one way to describe it. And I think I've mentioned the responsiveness aspect. So that responsiveness and deeply diverse and inclusive mindset to the work itself enabled us to create a tool set that has been used in many different countries by all kinds of organizations. So it's actually now, for the studio, I think probably the project with the most impact out of everything that we've done so far. Next slide, please. This is a short version of who was involved, and so I just wanted to make sure that some of our key partners were acknowledged. So Access Alliance particularly in their involvement in supporting the project, Unity Health, Costi, Michael Garron Hospital, and you can see on the left-hand side just the very large number of collaborators, including 11 different medical students and their families who provided voluntary translation services. In our first tool, we had 12 different languages represented. So that was a particularly timely support that we received from those families. So we're very grateful for their involvement. Thank you. And this is just a picture of one of the one pages being used as a poster by Costi, who run refugee and undocumented. They run health services for refugees and undocumented workers in Toronto.
Thank you, Kate. Michelle.
Guess I'm up. Hi everyone. My name is Michelle. I use she, her pronouns. I have black hair and black frames, and I'm wearing a really um blue turtleneck today. Yeah, I am a service designer slash UX designer with the province of British Columbia. And today I'm going to be talking about a project I did with the Government Digital Experience Division under the service design team. And it's going to be about digital and printed resources that we created with families about vaccines for children 5 to 11. We can go on to the next slide. Yeah, just before we start, here's the finished product. I'll go over how we got here. It was a lot of work. We have the brochure translated in a couple different languages, or the brochure, postcards, and media pieces in a couple different languages. We did French, Spanish, traditional and simplified Chinese, Vietnamese, Korean, Japanese, Tigrinya, Tagalog, Punjabi, Hindi, Arabic, and Farsi. So those are the top 12 languages for our province, and it's pretty important that we have information in those languages, and I'll go into that a little bit later. But here are the products that we did. Um, Here's the timeline. So it's kind of complicated. It looks linear, which it sometimes is, and then in the next slide, I'll show you how it kind of ended up looking like realistically. But we started out with discovery research, just trying to get to understand what our research question is, who we're gonna or who we're supposed to talk to, who we should be talking to, who we can't talk to, and figuring those pieces out. And then we started to design the workshop and synthesize what we learned from our discovery research. And then we started to do the co-design sessions. We took some time to kind of unpack what we learned, and then we started drafting and prototyping what we could produce out of what we found. And then from there on, it was a bit of a mess with approvals, usability testing, implementation, working with different partners, and then distribution. So in the next slide, you kind of see what it kind of realistically looked like. It was okay, kind of smooth for a little bit, and then it started tumbling down to this mess. But it's a fun mess. We get to hear from a lot of different partners and more community organizations and ministry partners want to get involved. So that means more approvals, more designers, more feedback, more leadership. So it gets a little jumbled up into this in this work. And then we start to see demand after that too. And when we finish a project, our team is cost recovery at this point. So how do we continue that work? So that's something we're always thinking about. In the next slide, we'll see some of our collaborators. My team is, or my ministry is the Ministry of Citizen Services, but we work really closely with the Ministry of Health to do this work. The folks who actually wrote the content were from the BCCDC. They are the folks who have the knowledge and the medical context to help us actually develop the information. And it was also validated by our children's hospital here in BC. Some of our distributors, and these are just a few of them, were our health authorities. We also had BC libraries, some of our regional community centers and community organizations, pharmacies, even our political leaders and MLAs. And so this is a really great example of how well we work together as an internal ministry. Our team was also, or this work was also nominated under a portfolio of vaccine campaign projects for the Premier's Award for Organizational Excellence. And that's because our ministry really talks to each other to make sure that we get the information out to as many people as possible. So there's next slide, I'll talk a little bit about the project specifically and our research objectives. So we wanted to better understand the needs, expectations, challenges that our families were facing. So this is really important to kind of get not right because it's never really right, but we're trying to get a really good high level picture before we start. So we engage with parents of different communities with different mindsets and involvement in our community. And this was a little bit of a challenge because coming from, the government, some folks don't want to interact with us, and we got to be careful about how we impact their trust with the government. So that's something we were really mindful of. We also want to kind of better understand the vaccine information journey, and also just the health experience altogether, and different service touch points, like even with Service BC, who helps us get our vaccination card here in BC. We just kind of want to get a picture of like how people are interacting with our services and how that impacts their level of trust with us. And ultimately, we want to identify the different approaches to keep families informed. So that could be digital media, it could be printed resources, it could be advertisements. So just wanting to get a better picture of like what's resonating with folks and how are people preferring to consume our information. And our next slide, just some statistics about how many folks we engage with. So we had 17 co-design sessions with parents of young children, their family members, and kids as well. We also engage with early childhood educators and some elementary school teachers as well. So these are just like a couple of locations that we engage with. And 100 Mile House we did not go to, but we have some folks across, some folks as in like some of our colleagues are scattered across BC. So we were able to do some in-person work as well as a lot of virtual things, especially with places like 100 Mile House. In the next slide, I'll talk a little bit about what activities we did. So we kind of started with usability testing of our quality assurance web content. So QA just kind of means like the work wasn't published yet. So at that point, like everything was under QA, which is like not published to the public. So kind of want to understand how not participants, but yeah, participants and parents would engage through the website, how they would click through it, how they would consume the information, what was missing, what challenges they face. So yeah, that's kind of usually how we start a lot of our work because we are the government digital experience. And our team at that time was in charge of our government website, gov.bc.ca. So after that, we kind of moved on to doing some co-design activities after we kind of surfaced a lot of gaps through the usability testing. We kind of learned that there's a lot of pieces, like we're just writing content digitally, but there's a lot of gaps in their every day-to-day life that we're kind of missing. So it'd be nice to work with families to kind of understand that on a more real level. Yeah, so in the next slide, these are kind of the more specific co-design activities that we did. So this is in the digital space. We used Mural for this, but we also have a printed versions for when we are in person. So for these questions, we're trying to understand what's top of mind for families, what feels like one of the biggest questions that they have. So what we try to do here is make it a little bit interactive, and a lot of parents or families aren't really familiar with using Mural. And that's something we learned along the way. So a lot of times we act as the hand and the cursor. So we'll end up populating it for them, but a lot of families do like to drag it in themselves, and they do find it kind of fun. So that's something we learned as well. So yeah, we kind of had this rating system, this Olympic, pedestal situation. So we got folks to like kind of rank what feels important to them. And sometimes it's not so linear. So there are some sticky notes here and there, sometimes kind of capturing the nuances. We also had activity where we kind of walk through the different steps of getting vaccinated for families and what questions they might have, what barriers they might anticipate coming across, and just kind of mapping those out. And so this is just to kind of get folks thinking about the process again, jumping into a session can be a lot for folks. Like they just finished work, they may have just finished feeding the kids. Like it's hard to just kind of start thinking about the vaccine right away, or getting getting to a clinic. So we're trying to get folks thinking about it before we start the co-design, the fun co-design activity. So in the second slide, or the next slide, we see again some mural activities, and in the corner you can kind of see like the printed versions. But so we kind of prepared different medias like printed posters, Instagram posts, videos, tweets, or X's, I don't even know what they're called anymore, notices that kids take home from school, brochures, and folks were encouraged to kind of pick a media that they prefer and kind of design alongside us. So they'll be like talking about what title we should use and what icons we can employ, and QR codes maybe. So just kind of putting those together all together. And so we did it with families, but with the consent of the parents. Sometimes the kids would get involved. They're kind of nosy in our business, so they just come in and kind of share. Some things we heard was like some kids want ramen after they get vaccinated as an incentive. So I'm like, I could get on board with that. But I don't think that's going to be realistic. But I love that they got involved and they were able to have a hand in this and giving them that agency. It was kind of helpful. We did end up making some not BCCDC posters, but our like higher government communication posters using the information that the kids shared with us, so that they have resources that they can use as well. And so they can be an active participant in their health as well. In the next slide, this is kind of like what we learned or experienced as we're building this with parents. We learned that building trust and sharing a mission was a really special part of engaging in co-design with families, because we did engage with a couple of the same parents through the usability testing and through the co-design. So we were able to kind of touch base during the whole COVID experience, not whole COVID, but like part of it. And they were able to kind of express how they felt throughout the different phases of the pandemic. So that really kind of helped us build trust with them. They were also able to see their designs come to life and be in person and sometimes at pharmacies. So they really liked seeing that. And they loved that their feedback could help impact the lives of families who weren't participating in this activity, which is like all the parents of BC. So they really were happy that they were able to be involved. Parents were able to ask questions and also find answers while we go through our usability testing, or as we're talking through some resources, we're able to share with them what we know. And we were able to share with them transparently like how we can do things and what we on our team have control of. And so that was really special too. It was really personable. In the next slide, still kind of on that theme of trust, we ended up building trust with parents, of course, but we also were able to build relationships with health knowledge translators from BCCDC, different leaders, and public service employees within different ministries and organizations. We were able to work with printers, which is my first time working with printers. So we have printers internally. So we were able to kind of do all of that printing work with them and coordinate with the warehouses to keep them. So that's really outside of my scope of work, but then we ended up doing it. It was really like a special experience. So have like a network over there too. We were able to share findings with different community organizations locally, and that was also really awesome. And yeah, identifying different outreach streams with government communications team. Like, we have a lot of network that I wouldn't personally know, so we really relied heavily on our teams to help us with that. And then translating the materials, we worked with our internal translation team or multi-language services team, and we ended up growing a whole new project that was funded for 2 years about multilingual content about COVID, but also just with Welcome BC, which is our immigration resource. So that kind of blossomed into a whole new thing. And then I ended up starting a design team over there to do more research about multilanguage resources. So kind of all snowballed from there. Yes. So in the next slide, here are some of the key outcomes. Of course, we have the resource. We also have some artifacts documenting key questions and challenges. And so that kind of lives internally on our team. Documentations of how we worked, processes that worked and didn't work. And so I kind of have a good, like a collection here of things that I can do better next time. We of course have those lasting relationship with our internal teams and community partners, and ultimately that leads to better collaboration for other projects that are not COVID related. Yeah, so that's it. I think in the next slide it's a giant photo of myself. I was like, how do I make this a little smaller? I have my gov email, which is just my name, and another one which is also my name with double N, and that's my personal email. So if you have any questions, feel free to reach out.
Thanks so much, Michelle. Really interesting presentation. Christine.
Hi, everyone. So my name is Christine, and I'm a graphic designer with an interest in design and public health, as you all heard already. You can go to the next slide. So I work as program coordinator and kind of like studio manager of the Health Communication Design Studio, or HCDS as I'll usually refer to it. And if you're interested in learning more about us, you can scan the QR code. It goes to our website, I think. So our studio is actually a pretty new entity. We're just entering our 3rd year, which is really exciting. So I just want to thank the Co-Design Beyond Pandemics team for inviting me to speak. This is a really exciting opportunity. Next slide. So the project that I'm going to be talking about is funded through the National Institutes of Health Community Engagement Alliance, which is kind of a new set of funding that started during the pandemic. And it's an initiative present across, I think, 21 different US states and territories now. So our studio works hand in hand with the Health Communication Research Laboratory on campus on a variety of different projects under this SEAL Alliance, each with the express intent of engaging community in St. Louis. So we've kind of expanded outward from COVID-19 related issues to address some broader community concerns like mental health. So in the next slide, so I just want to kind of talk you through. So it's interesting to think about the language of this. So we've been really calling it co-creation, but this is kind of co-design. I'm not sure if there's huge differences between the two or if there are, but I'll just be referring to the project as co-creation, but under the umbrella of co-design as well. So our project, Co-Creation, Prompting Conversations with Teams, was really meant to investigate the actual process of doing co-creation with community. And originally we set out to use the method to bring in 50 African-American community members to evaluate materials developed by us in the lab across multiple different projects. But instead, we kind of pivoted before even starting, and we narrowed the project down to sort of be like 2 parts of it. So there's the pilot project about prompting conversations with teens. and then this kind of like meta project of evaluating the effectiveness of co-creation itself. So in the next slide, you can kind of see like a scaled down version of our original proposal, which asked, potential panel members to attend and commit to being a part of this co-creation panel. And so that's just an example of our recruitment material out there, one pager. Yeah, so I guess also I just wanted to share in the next slide a few action shots from our workshops. So this was, I think, kind of quote tail end of the pandemic. So we were able to sort of incorporate virtual and in-person methods as well as asynchronous things, which was really exciting and really cool to kind of see those go hand in hand together. So you can go to the next slide. So like I mentioned before, these are kind of our project objectives. So is the co-creation approach feasible, and are co-created messages and deliverables more effective than traditionally created materials? So these are like really nice and succinct, but I think there's so much under the umbrella of these statements, maybe more than we originally anticipated when kind of writing this. So in the next slide, I'll just kind of touch base on our partners and collaborators. So outside of the HCDS and HCRL team members, we brought in two fabulous facilitators and co-conspirators outside of the university from the Public Design Bureau to help run the project. So from planning with us to producing a final report. And then our panel members themselves included folks related to some local LGBTQIA+ organizations, such as the SPOT, which is an organization dedicated to sexual health and young queer folks' well-being, and then also Squish, a queer support hotline in St. Louis. So in the next slide, you can see this is kind of like a huge planning team, at least on our scale. It was really difficult for us to find a time to all come together at the same exact time, which I'm sure many people have encountered before. So it's usually parts of this group that met for planning and reflections and participated in the workshops too. And I think that kind of worked out for the better because we wanted to be mindful of the community panelists as well, and making sure that we didn't overwhelm the group with our voices or make them feel kind of uncomfortable with sharing. So in the next slide, so we kind of ended up with this set of panel members. So it was a very kind of small, intimate group of 5 adults who work closely in this area of interest, but also 3 recent high school graduates. Next slide. And so, as I'm sure also many projects go, ours was quite chaotic in terms of timeline. We had lots of movements and shifts with grant funding and different things that we couldn't really control from our end. So in the end, kind of our planning period ended up being from around November 2022 to April 2023. And then we finally kind of rolled out the co-creation panel project from May to August and into this month, honestly, with final reflections and a report coming out. The next slide. Yeah, so this is kind of building off of Michelle's timeline stuff too, but it's not as linear as you think it is. So I kind of just wanted to share this wonderful graphic from the Public Design Bureau that kind of encompasses like all the different moving pieces that come in like a quote linear process. And so the light green is the like planning team activities, and then the dark green is what all of the panel members participated in. So really exciting to kind of see all of it in one umbrella. Next slide. So from planning to final phases of the project, the planning team kind of participated in around 24 planning and prep sessions. And the 3 prongs of the planning team, so the Public Design Bureau, HCDS, and HRL, focused on different areas of the project. So HRL members really took on message creation alongside the Public Design Bureau and IRB coordination. And then studio members kind of created testable materials and workshop activities. And the Public Design Bureau documented and coordinated all aspects of the workshops, recruitment, and additional activities. And they also made things too. Next slide. So the first portion of the project, like I said, was November 2022 to April 2023. And we really wanted to be able to get this right from the get-go, to give ourselves enough time to create an enjoyable, joyful, like mutually beneficial and meaningful process for panelists who were involved. So I just kind of highlighted a couple things that we did here, which was making sure that we're narrowing in on a topic, and kind of showing how we got to that, as well as generating team norms, which I think was really important to do at the beginning, and to have a big discussion and to kind of leave it open for panelists to also contribute to as they were brought in. Next slide. And then comes recruitment. So we initially set out to use a snowballing method, which allowed us to kind of reconnect with existing partners that we have, as well as forge new relationships through them. And we also kind of discussed the various options for how we would construct a co-creation team. And so this kind of left image is what we landed on, but it can really take on multiple forms depending on the project. But this is what we landed on. We ended up with kind of a co-creation team that involves the planning team and community members at the same time. Next slide. So a really key time of the project for us, I think, was kind of this discovery phase, which is when we invited all the panelists to come in. So maybe a little earlier than a typical co-creation process might. And so this activity consisted of lots of brainstorming. We had virtual and in-person options where participants, we kind of diversified the content and activities in this phase. So we looked at a lot of different materials, whether that was existing, booklets, digital tools, etc., related to LGBTQIA+ teens and mental health conversations, or color palettes, patterns, images, and different message tones. And I think one thing one important thing out of many that we got out of this was that a tool that we found really, really helpful in this was AI generation, actually, which kind of sped up the process and allowed us to be a little bit less precious with all of the materials we were sharing, which I think was really key at the beginning stages. Next slide. So this led us into ideation, where we got a little bit more specific with things. So we had brainstorms, and this is where we also had a virtual and in-person option. And so participants created idea sheets. I think this is a Miro board, but it's very hefty, so I apologize if you can't quite catch everything. But the idea sheet sort of consisted of picking a target paired audience. So for example, supportive adults and unsupported teens, or something along those lines. A goal, so for example, getting connected to resources, a scenario context, so I'm talking to my grandparents about my identity, or something along those lines, or I'm at school, and then a format as well. And so from there, our design team created kind of more slightly higher fidelity concept pages, which you can see an example of in the top right. And this is when we finally got into prototyping. So using the prioritization feedback and the concept pages, our group landed on an idea, which actually was an idea that we really didn't anticipate at all at the beginning of this process, which is a game, which is kind of an unusual format for health-related materials, or kind of things connecting you to resources. So it's a conversation card game where players ask questions of varying intensity and seriousness across different topics to get to know each other better, to kind of break barriers, to learn and to connect. So prototyping this out included a lot of different moving parts. For example, kind of mood boards, color and type explorations, game mechanics and rules creation, And this is all kind of going hand in hand with messaging and content writing. And all of this material was kind of built out of the previous phases. So, you know, making sure that we're really incorporating all of the feedback and conversations that we've had with panel members. Next slide. So in our final phase, it's really kind of coming together. We refined the card prototypes and the game mechanics as a full group, and kind of sent it all out to panel members for feedback. And we also did some outside message testing at community events in St. Louis, which was really exciting to be able to not only just have our panel members' voices, but more voices from the community. And we're currently working on finalizing the next level prototype. Next slide. So I think two key pivots really happened throughout the project, and that has to do with timeline and scale. So our timeline shifted so much at so many different times, and at some points we didn't even think we were going to be able to do the project. So that was difficult, but also I think a really big positive that arose from this was our partnership with the Public Design Bureau as kind of an outside source from our research teams. It was a huge help for lab and design members to be able to participate in the process fully, in the making, in the planning as well, but without worrying so much about the like nitty-gritty details of organization and management. And then the second pivot is really scale. So as I told you before, we originally wanted to recruit 50 panelists who would work across multiple projects, but this wasn't really feasible to implement with the time or the budget we had. So it became kind of this much more like intimate, tailored group of people focused on kind of a key population that we hadn't really considered before, which was LGBTQIA youth. And so this project was conceived like during the pandemic. So we already knew we were going to have to use different approaches and multiple approaches. And I think what we appreciated about that process was the connections between different conversations. So an in-person and a virtual workshop, if there were lots of connections, they kind of became even more highlighted and clear. But if there was diverting discussions, it also allowed us to kind of investigate that further and make different decisions. So it kind of allowed for people who also wouldn't traditionally participate to maybe feel more comfortable and able to participate because there were so many different options. Next slide. So just kind of big picture outcome was, yes, co-creation works and is great for both us and the participants. So for everyone. And then if you dig a little deeper into that in the next slide, I think just a few clear things we saw. Sorry, next slide. So we learned to be flexible and that narrowing the scope is important in ideas and creation. I think that was prioritization of ideas was kind of a difficult phase because us and our panelists had a hard time letting go of, you know, certain audiences or certain ideas. But I think like that process itself was huge in moving moving the project forward. And the last thing is just like leaning into those bumps in the road and being able to kind of go with the flow and go with the idea shifts and let go of any preconceived notions you might have had about where you saw the whole co-creation process going, or like what project you envisioned coming out of it. And then next slide is going even deeper. I won't go into these, but the Public Design Bureau did a really fantastic final report kind of summary page that digs a little deeper into some of the other kind of outcomes. And actually, I will mention one, which was this kind of whole thing happened over the summer, which we found was extremely difficult to plan for, just with summer and vacations and all of that, and especially with young team members. So we hope to avoid that time frame in the future. Great, and then next slide. So I just wanted to share just a couple kind of concrete things that came out of the project. So we have this beautiful project report from the Public Design Bureau, along with all of the materials, agendas, like slide decks that we could possibly need for future co-creation processes. So this report isn't publicly available yet, but hopefully we're able to kind of share some of it soon. And then next slide. So something I found really, really exciting about this report was the frameworks that came out of it, because I think they're highly applicable to doing this type of work in the future. So for example, that kind of funnel topic we talked about, just like different spectrums too, for thinking about the different areas of a co-creation project. And the next slide also shows you some further examples of that. And we also came out of the project with products. So we have, next slide, we have game instructions fully fleshed out, as well as kind of a summary version of that. We have a whole repository of messages that we're continuing to test, and we have initial card designs, which is really exciting. So next slide, I'll just leave you with a little sneak peek of the future. So this project, while it's technically ended, it's not really ended. It's kind of evolving into the Community Engagement Alliance's year 3 projects that we're doing, kind of still around teen mental health, and we'll be partnering with community organizations to recruit community members for more testing, to disseminate a version of this product, and also to evaluate the use. So thank you. And I think you also see a big image of my face, maybe not the next one, but the one after that. And feel free to contact me with any questions or thoughts.
Thanks so much, Christine. I really like how you suggested that you have to lean into project changes and upsets. Just, you know, as part of any project, inevitably things change, and it seemed like, I guess across even all of the 3 presentations, there was so much flexibility and creativity within all of the projects that, you know, you just kind of have to embrace. So if there's any questions about the webinar or the project, feel free to contact me. I'll put my email in the chat here. The other thing you can do is join the COP. So that's the QR code on the right. That what we're hoping is that we can continue this conversation. And then the next webinar related to this topic of co-design beyond pandemics, it's going to be on transparency in the design process. And it's on October 12th. The U of A will be hosting it as well. And please answer the survey if you haven't done that. That's the QR code in the middle. And James also put that in the chat. So again, I just want to thank the speakers, researchers for presenting, fabulous talk, and to all the participants for coming.
Thank you, everyone.
Thanks for the opportunity.
Yeah, thank you. It was so great meeting all of you folks, and